I'm Barry Greenberg, and I'm professor of medicine at the University of California in San Diego. I'm also director of the Heart Failure Treatment Program at UCSD Medical Center. It's important for you to know what heart failure is, what are the signs and symptoms of heart failure, when should you contact your physician about symptoms that may be worrisome or worsening, and then finally, what you can do on a daily basis to have a more healthy lifestyle. We hope that this video will be helpful to you in living with heart failure.
For those of you who have been diagnosed with heart failure, it is important to know that you're not alone. Heart failure affects more than 5 million Americans, and approximately 550,000 cases are diagnosed each year. Regardless of the way it may sound, heart failure does not mean that your heart has suddenly stopped working. It simply means that your heart is not working as well as it should. A healthy heart is strong enough to pump blood out of the heart into the lungs. The blood picks up oxygen from the lungs and then returns the heart before being pumped throughout the body. A weakened heart is unable to pump effectively. When the heart isn't pumping effectively, there is a slower blood flow, which causes blood from the lungs or from the rest of the body to back up. The weakened heart muscle now has to work harder to keep the same amount of blood moving throughout the body. With the heart muscle working so hard, the heart chambers stretch and become enlarged. As this enlarged muscle tires, it becomes weaker and the disease becomes worse. The good news is that early diagnosis and new treatments are allowing many people with heart failure to continue to enjoy their everyday activities and to live longer. It's also important to know what the symptoms are of heart failure. You may feel like you do not get enough air when you breathe. You may huff and puff even when you're not doing anything tiring. If fluid has built up in your lungs, it makes it harder to breathe. This can get even worse at night because when you lie down, even more fluid can build up and in and around your lungs. Frequent coughing. You may often cough. This cough can also get worse at night. Fast heart rate or heavy heartbeat. Your heart may feel as if it is racing or pounding. Tired and weak. If you feel tired and weak, you cannot work and do the normal things you do every day. Even walking up the stairs or carrying in groceries can be hard to do. Swollen ankles, legs, and or belly. These are all the places where fluid may build up. This can lead to swelling, making them seem puffy and larger than normal. Your shoes and your rings may feel tight. Your clothes may also feel tight around your waist. This swelling is often worse at the end of the day. You might also have a loss of appetite. You may not even want to eat when you should be hungry. You may also feel a little sick to your stomach. Weight gain. When extra fluid builds up, it shows up on the scale as extra weight. That is the reason you need to weigh yourself daily. An important aspect to know is when to call your healthcare provider. It is extremely important for you to weigh yourself daily. You need to do this at the same time every day, preferably when you wake up in the morning, after urinating. Always wear the same amount of clothing every time you weigh yourself. Keep your weight written down in a log. If you gain more than 3 to 5 pounds in 1 week, you need to call your healthcare provider.
Good morning. I would like to make an appointment.
An important thing for you to know when you leave the hospital, you need to weigh yourself that day. It is probable that your home scale will be different than the one we have in the hospital. So you need to know what you weigh on your scale, starting from day one. Other times that you need to call your healthcare provider are when you have increased shortness of breath, when you have increased swelling in your legs or stomach, a very slow or fast pulse, when you're lightheaded or dizzy, when you have unexplained side effects after taking your medicine, and if you ever experience chest pain, you need to call 911. Medicine is a key factor in treating heart failure. Medicine can make it easier for your heart to pump, strengthen your heartbeat, and remove excess fluid from your body. It can also improve your overall quality of life when used as directed. When you take your medications incorrectly, the medication can be useless, even worse, harmful. Please follow these guidelines for taking your medicine. Ask questions about your medicine, such as, what are they for? When should I take them? You should know what medication is your diuretic, otherwise known as your water pill, and which pills are for your heart, and all the other medications you may be taking. Please check the label before you take a medicine. Be sure that you're taking the right one and have the correct dose. Always follow the directions carefully. Don't take your medications in the dark. It's easy to make a mistake and take the wrong one. Tell your healthcare provider if you have any other prescriptions or take any other over-the-counter medicines. Even aspirin, pain relievers such as Motrin, Advil, herbal supplements, or vitamins. They could react with the medications you have been prescribed.
If I can, please.
Ask your healthcare provider what you should do if you miss a dose. Never take a larger dose the next time without their permission. Report new side effects to your healthcare provider. He or she may need to adjust your dose, prescribe a different medication, or even make other changes. Have a written list of the medications you take every day, the dose, how many times a day you take it. This includes any of the vitamins or over-the-counter medications. Always bring this list with you to every healthcare appointment. Always carry a copy of this list with you. This can help your healthcare professionals in an emergency. Keep it in your wallet or purse at all times. Even if you're feeling better, take your medications as prescribed. Don't stop taking a medication without talking to your healthcare provider first. Changing the sizes of doses or skipping doses can be extremely dangerous. Even if you are taking a diuretic or water pill, or you do not have any of the symptoms I just mentioned, following a low-sodium diet can help you. Your goal for sodium intake is 2,000 milligrams per day. 2,000 milligrams looks approximately like this. Salt just taken from the shaker, but remember that there's salt added to every food that you ingest. But there's several steps that you can take to lower your sodium intake. Start by adding no salt to your food. Avoid foods that are smoked, pickled, or cured, such as ham, pickles, olives, bacon, and corned beef. Avoid eating salty snacks, such as pretzels, chips, salted crackers. Choose unsalted snacks instead. Processed foods such as frozen dinners, canned soups, vegetables, and chilies are also very high in salt. The best substitution for these foods is homemade meals without added salt. If you're unable to make homemade meals often, look for store-bought items that say low sodium, very low sodium, or no salt added. Low salt cookbooks are very helpful. You can get those cookbooks from your local public library or bookstore. In addition to limiting your sodium intake, it is important to follow a healthy diet. Eat plenty of fruits and vegetables, about 5 servings per day. 1 serving of vegetables is ½ cup cooked or 1 cup of raw vegetables. 1 serving of fruit is about the size of a woman's fist or 1 cup of cut fruit. Choose lean meats such as turkey or chicken breast or fish. The portion size should be about the size of a deck of cards. Limit red meat to about 2 to 3 times per week. Bake, broil, steam, or barbecue your meat instead of frying. Limit greasy and fatty foods such as butter, margarine, salad dressing, oil, or gravies to 1 teaspoon per meal, which is about the size of a woman's thumbnail. Try using reduced fat and low-fat products. Exercise is extremely important and should be incorporated into your daily life. Exercise is very good for you if done correctly. It can improve the flow of blood throughout your body. It can strengthen your heart. It can help you lose weight or stay at a healthy weight. It can lower your blood pressure and cholesterol levels. And it can also help you get rid of stress and give you more energy. Make sure that you ask your healthcare provider before you can begin to exercise. Never start an exercise program without his or her permission. If you're given the okay to begin exercising, start slow. Walking is the best way to exercise for heart failure patients. Wear flat shoes and shoes that are comfortable. Exercise at the same time every day so that it becomes a habit. Don't exercise if it's very hot or very cold outside, right after you eat, or if you do not feel well. Avoid any weightlifting or any activities that you have to hold your breath or bear down because they can raise your blood pressure and strain your heart. Stop exercising immediately and rest if you feel tired, you have chest pain, or you're very short of breath. Call your healthcare provider if any of these symptoms do not go away. An important thing to know is that if you smoke, you need to quit. Smoking is extremely damaging to your heart. Smoking narrows your blood vessels, making it harder to breathe. It increases your blood pressure and your heart rate. It also increases your risk of developing other heart and health problems. Please don't wait. Quit now. Your healthcare provider can help you with that. Now I'd like to talk to you about emotional health. Learning that you have heart failure can bring about a variety of emotions. You may feel angry, anxious, stressed, or depressed. That is normal. Make sure you talk to your friends and family. Talking about your fears and concerns can help. Try to stay active. Go for a walk with a family member or make plans to go out with a friend. Ask about your sexual concerns. Talk with your healthcare provider about when you can resume sexual activity. Resuming sexual activity should help you to feel better, not create stress. If you find yourself losing interest in the things you used to enjoy, feeling tired, having feelings of hopelessness or guilt, you may be depressed. Please seek help and support from your doctor or nurse. They can lead you in the right direction. You'll be receiving a self-care handbook called Learning to Live with Heart Failure from your nurse before you leave. This book has all the information we went over in the video, so you can refer back to it at any time. Please use the daily log for your weight. There's a space for you to write down your daily weight each day. Also, the medication card is located on the last page of the booklet. Fill out your medications and keep this card with you at all times. You'll find this booklet very useful. Before you leave the hospital, be sure you know when you need to see your healthcare provider again. They most likely need to see you soon so they can closely monitor your heart failure. I hope this video has helped you learn a little bit more about learning to live with heart failure. If you have any questions, please let your nurse or your healthcare provider know. Thank you.